This DVD from the British Hypertension Society aims to show the basic process of having blood pressure measured as reliably and accurately as possible. Blood pressure measurement is almost certainly one of the most commonly done clinical procedures around the world, but it is often done poorly. By following simple, standardized principles, measurement can be greatly improved. Although there are hundreds of blood pressure monitors on the market, only a few of these have been validated. Wrist monitors in most instances are not as accurate as upper arm devices. Even though some have passed validation criteria, upper arm devices are preferred. The blood pressure devices you are seeing here have all been independently validated on BHS criteria. Up-to-date details of all validated devices for both home and hospital use can be found on our website. If you're measuring your own blood pressure at home, as anywhere else, you should first make yourself comfortable sitting upright. Your arm should be supported on a table or desk so that you can apply the right-sized cuff comfortably, with the cuff on your arm at the level of your heart. You should wear loose-fitting or short-sleeved clothing, as the cuff must be applied next to your skin. The readings should be taken after a minimum of 5 minutes rest in the seated position, and 2 to 3 measurements made on each occasion. You should remain still and not talk during the readings. You should use the same arm each time you measure your blood pressure. If you change arms, always record which arm is used. For home measurement, the recommendation is that sets of 3 measurements should be taken twice a day, in the morning before taking blood pressure treatment and again in the evening approximately 12 hours later. Repeating this process over several days is ideal. If there is more than a 10 mm of mercury difference between consecutive recordings, further readings are required. Do not be concerned, but try to continue after resting for a bit longer and aim to obtain at least 2 stable readings. Keeping a record of blood pressure measurements, along with the date and time, is very important, particularly in relation to when blood pressure tablets are taken. It is very important that you do not alter how you take any medication as a result of blood pressure readings done at home, unless you are advised to do so by a doctor or nurse. Greeting the person or patient and making them welcome and comfortable are key to a relaxed atmosphere. The patient might find the cuff becomes quite tight, more so if a higher pressure is expected, and people can be anxious when having their pressure measured. As mentioned before, the patient should remain seated comfortably, still and without speaking, for 5 minutes before measurements are taken. During this time, avoid making any potentially stressful comments to the patient. A cuff of the right side is applied to the mid-upper arm next to the skin. Many cuffs show which part should be applied over the inner part of the arm, above where it bends at the elbow, under which the brachial artery runs. Being able to slip 2 fingers under the cuff indicates that it is closely applied, but not too tight.